Merci beaucoup, Jean-Sébastien. Good afternoon, everybody. Today, I'm joined by Dr. New, Brigadier General Brody, and Madame Paquette from Public Services and Procurement Canada. So we'll begin right away with Dr. New. À vous, le Dr. New.
Over to you, Dr. New.
Merci, Ministre Leblanc.
Thank you, Minister.
Bonjour à
Leblanc.
toutes et à tous.
Good morning to
Disease activity
everyone.
and severity trends remain at much reduced levels in most jurisdictions across Canada. Total active cases are now below 4,700 for the first time since late August last summer. And there are 400 new cases being reported daily. Severity trends continue to decline, with 87% fewer people in hospitals with COVID-19 daily than the peak of the third wave, and an average of 9 deaths are being reported daily. To date, over 45 million doses of COVID-19 vaccines have been given in Canada, which equates to over 26.5 million, or 80% of eligible people aged 12 years or older in Canada with at least one dose. The proportion of eligible people who are now fully vaccinated is now over 57% and steadily increasing, with many more people registered or intending to get vaccinated. The latest Canadian data from June tells us that 84 to 88% of those surveyed have either received a dose of COVID-19 vaccine already or intend to get one soon. This is great news because the more people who get vaccinated, the stronger our vaccination firewall will be for all our benefit. When we say every vaccination counts, it applies to all eligible ages in all areas of the country, as well as to people who have had a previous COVID-19 infection. That's because any gaps in protection for you as an individual or for Canadians collectively is a weakness in the firewall where the virus can get in and spread. And there is a lot to protect inside the firewall, from your health to the health and well-being of all those who can't get vaccinated, such as young children and those with medical contraindications to the vaccines. With 7 weeks to go before the fall and back to school, college, and university, there's just enough time to turn our best intentions into reality and readiness. COVID-19 vaccination is important for everyone, including younger age groups, know how important they are in the vaccination effort. So if you haven't already, please make an appointment to get your first or second dose as soon as you are able. If you have questions or concerns, please reach out to a trusted source such as your healthcare provider or local public health authority, or visit canada.ca for comprehensive information on COVID-19 vaccines. Canadians are reminded that it is safe to receive one vaccine product for your first dose and a different vaccine product for your second dose. Likewise, Canada's National Advisory Committee on Immunization, or NACI, considers the mRNA COVID-19 vaccines Pfizer and Moderna to be interchangeable. That means if the same mRNA vaccine you received for your first dose is not readily available at your clinic, it is safe to receive another mRNA vaccine so you can complete your 2-dose vaccine series as soon as you're eligible. Bonjour à toutes et à tous. Les taux de transmission de la maladie et les tendances sur le plan du nombre de cas graves maintiennent à des niveaux très réduits dans la plupart des endroits au Canada. Le nombre total de cas actifs est maintenant inférieur de 4 700 pour la première fois depuis la fin du mois d'août l'été dernier. Et 400 nouveaux cas sont signalés chaque jour. La tendance à la diminution du nombre de cas graves de la maladie se poursuit. On compte 87% moins de personnes atteintes de la COVID-19 dans les hôpitaux par rapport avec le pic de la troisième vague et en moyenne 9 décès sont signalés chaque jour. À ce jour, plus de 45 millions de doses de vaccins contre la COVID-19 ont été administrées au Canada, ce qui signifie que plus de 26,5 millions de personnes, soit 80% des personnes admissibles âgées de 12 ans ou plus, ont reçu au moins une dose. La proportion de personnes admissibles maintenant complètement vaccinées est maintenant supérieure à 57% et augmente régulièrement. Et il y a beaucoup plus de personnes qui sont inscrites inscrites à la vaccination ou ont l'intention de se faire vacciner. Les plus récentes données canadiennes, lesquelles datent de juin, indiquent que 84 à 88% des personnes interrogées ont déjà reçu une dose de vaccin contre le COVID-19 ou ont l'intention de se faire vacciner prochainement. Il s'agit d'une excellente nouvelle, car plus le nombre de personnes qui se font vacciner est élevé, plus notre pare-feu vaccinal sera solide, dans notre intérêt à tous. Lorsque nous disons que chaque vaccination compte, nous parlons de toutes les tranches d'âge admissibles, dans toutes les régions du pays et de toutes les personnes qui ont déjà contracté la COVID-19. En effet, toute lacune dans votre protection à vous et celle de la population canadienne est une faille dans le pare-feu par laquelle le virus peut pénétrer et se propager. Et ce pare-feu protège beaucoup de choses, de votre santé personnelle à la santé et au bien-être de tous ceux qui ne peuvent pas être vaccinés, comme les jeunes enfants et les personnes pour lesquelles les vaccins sont contre-indiqués pour des raisons médicales. À cette semaine de l'automne et de retour à l'école, au collège et à l'université, il reste juste assez de temps pour donner suite à nos meilleures intentions et à nous préparer. La vaccination contre la COVID-19 est importante pour tous ceux qui se trouvent dans les groupes d'âge admissibles. Donc, avec ce dernier appel, à vous retrousser les manches, je veux que tous, y compris les plus jeunes, sachent à quel point ils sont importants dans l'effort de vaccination. Si vous ne l'avez pas encore fait, prenez rendez-vous pour recevoir votre première ou deuxième dose dès que vous le pouvez. Si vous avez des questions ou des préoccupations, adressez-vous à une source fiable comme votre fournisseur de soins de santé ou les autorités locales de santé publique ou visitez canada.ca pour obtenir des renseignements complets sur les vaccins contre la COVID-19. Nous aimerions rappeler aux Canadiens qu'il est sécuritaire de recevoir une première dose d'un produit vaccinal et une deuxième dose d'un produit différent. De même, le Comité consultatif national de l'immunisation, ou CCNI, du Canada considère que les vaccins contre la COVID-19 à ARN messager, Pfizer et Moderna, sont interchangeables. Cela signifie que si le même vaccin ARN que vous avez reçu pour votre première dose n'est pas immédiatement disponible à votre clinique, notre vaccin ARN messager sera sûr pour compléter votre série de 2 doses de vaccin dès que vous êtes admissible. Merci. Thank you. Miigwech.
Thank you very much, Dr. New, and we'll now turn to Brigadier General Brody. So over to you, General.
Thank you, Minister. This week, we are bringing in 7.1 million doses of COVID-19 vaccines, including 4 million Moderna and 3.1 million doses of Pfizer-BioNTech. By Friday, we anticipate 63 million doses in Canada. We expect to cross the 66 million threshold next week, which will signal that there are sufficient doses in country to vaccinate every currently eligible Canadian. But it is important to note that our domestic vaccine requirements do not end there. Canada will need continuing access to vaccines for newly eligible populations and for additional doses over time as the virus evolves. We also need the flexibility to pivot doses to support our donation efforts. With this in mind, we are managing Canada's COVID-19 vaccine supply strategically to ensure vaccines are stewarded to best support Canada's evolving domestic needs and optimize ways to support global vaccination efforts. Canada's strategic vaccine supply is the framework by which we balance our national vaccine portfolio. It includes vaccines produced and provided direct from manufacturers based on Canada's procurement agreements, and doses that are shipped to federal, provincial, and territorial jurisdictions to support the immediate needs of immunization programs. It also includes doses in central inventory allocated to the jurisdictions but held at their request, as well as a small, carefully curated supply to provide an operational buffer for urgent demands. Canada's strategic vaccines supply provides the system and mechanisms to bring in new vaccines as formulations and eligible populations evolve in the coming months, and to route vaccines to where they are needed most, at home and internationally. We continue to closely coordinate with stakeholders and partners to best align supply with demand as we seek to maximize vaccination rates and protect as many people as possible as quickly as possible. Cette semaine, nous apportons 7,1 millions de doses de vaccins contre le COVID-19.
This week, we're bringing in 7.1 million doses of COVID-19 vaccines,
4 millions de Moderna et
including 4 million
3,1
Moderna
millions
and
de doses
3.1 million
Pfizer-BioNTech.
doses of
D'ici vendredi,
Pfizer-BioNTech.
nous anticipons
By Friday,
avoir près de
We
63 millions de doses au
anticipate
Canada.
having received
Nous
63
prévoyons
million
franchir
doses in
le seuil
Canada,
des
and we
66
expect to
millions
cross
la
the
semaine prochaine,
66 million
ce qui
threshold
signifera
next week,
qu'il y a assez de
which
doses
will
dans le pays
signal
pour
that
vacciner
there are
tous les Canadiens et
sufficient doses
Canadiennes
in country
actuellement
to vaccinate
admissibles.
every
Mais
currently
il est
eligible
important
Canadian.
de noter que nos
But it's
besoins
important to
nationaux
note that
en
our
vaccins ne
domestic
s'arrêtent
vaccine
pas là.
requirements
Le
do
Canada
not
aura
end there.
besoin d'un accès
Canada
continu aux
will need
vaccins
continuing
pour les
access to
populations nouvellement
vaccines for
admissibles
newly
et pour les doses
eligible
supplémentaires
populations
au
and for
fil du temps à
additional
mesure
doses over
que le
time
virus
as the
évolue.
virus
Nous avons
evolves.
également besoin
We
de
also
flexibilité
need the
pour faire
flexibility
pivoter les
to
doses pour
pivot
soutenir nos
doses
efforts de
to
dons.
support our donation
Dans cet
efforts.
esprit, nous gérons
With this in mind,
stratégiquement
we
l'approvisionnement en
are
vaccins de
managing
Canada
Canada's
contre le COVID-19
COVID-19 vaccine supply
pour nous
strategically
assurer que les vaccins
to
soient
ensure
gérés de
vaccines
manière à
are
répondre le
stewarded
mieux
to the best,
aux besoins nationaux changeants du
rather to
pays
best support
et
Canada's
optimiser
evolving
les
domestic needs
moyens
and
de soutenir
optimize
les
ways
efforts
to
de
support
vaccination mondiaux.
global vaccination efforts.
L'approvisionnement stratégique en vaccins de
Canada's
Canada
strategic
est le
vaccine
cadre avec
supply
lequel
is the
nous
framework
équilibrons notre
whereby we will
portefeuille
balance
national de
our
vaccins.
national vaccine
Il comprend des
portfolio.
vaccins fournis directement par les
These
fabricants
vaccines are
selon les
produced and
accords
provided
d'approvisionnement
directly
du Canada,
from manufacturers
des
based on
doses qui
Canada's
sont
procurement
expédiées au
agreements.
fédéral,
And
provincial et
doses
territorial
are shipped
pour
to
répondre
federal,
aux besoins
provincial, and
immédiats des
territorial
programmes
jurisdictions to
d'immunisation.
support the immediate
Ça
needs
inclut
of
aussi un
immunization
inventaire
programs.
central
It
qui
also
comprend
includes
des doses
doses
allouées aux
in a
juridictions
central
à leur
inventory
demande
allocated to
et
the
les doses pour
jurisdictions, but
fournir un
held
tableau
at their request,
opérationnel pour les
as well as a
demandes
small,
urgentes.
carefully curated supply to provide an
L'approvisionnement
operational
stratégique en
buffer
vaccins
for
fournit le
urgent demands.
système et les
Canada's strategic
mécanismes
vaccine
pour
supply
introduire
provides
les
the
nouveaux
system
vaccins
and mechanisms
au
to
fur
bring
et à
in
mesure
new
que les
vaccines
formules et des
as
populations éligibles
formulations and
évoluent
eligible
dans les mois
populations
à venir
evolve in the coming
et pour
months,
acheminer les vaccins
and to
là où ils sont
route
le plus
vaccines to
nécessaires
where
au
they are
pays
needed the most,
et à l'étranger.
both at home and
Nous
abroad.
continuons à coordonner
We will
étroitement
continue
avec
to
les parties
closely
prenantes
coordinate
et
with
les partenaires
stakeholders and
pour
partners
aligner au mieux
to best
l'offre sur la
align
demande,
supply
tout en
with
continuant
demand
à
as we
maximiser
seek
les
to
taux de
maximize
vaccination pour
vaccination rates
protéger
and
le plus
protect
de
as many
personnes
people as
possible, le
possible
plus vite que
as
possible.
quickly as possible.
Merci.
Thank you.
Miigwech.
Miigwech.
Thank you very much, General Brody. Alors, Jean-Sébastien, à vous maintenant pour les questions.
To you for questions.
Merci beaucoup, Monsieur le ministre. Donc, tel que mentionné, nous allons maintenant débuter la période de questions. Ministers, the Brigadier General and Dr. New will now be happy to take your questions. As usual, it will be one question and one follow-up. Donc, comme d'habitude, ça va être une question et un suivi par journaliste. And I will now pass it over to the operator for the first question. Donc, je vais maintenant passer la parole à l'opératrice Kate pour la première question.
Now, over to the operator, Kate.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, la première question. Jacques Galland, Toronto Star, your line is open. À vous la parole.
Hi, good morning. My questions are about the border, and I suppose for Minister LeBlanc or Dr. New. With regards to fully vaccinated travelers, I'm wondering, could you explain why the government decided to keep the requirement for the pre-arrival test, but is removing the requirement for the on-arrival test and replacing that with random testing? Just because I note that the Health Canada expert panel on testing and quarantine had actually recommended doing away with the pre-arrival test, but keeping the on-arrival test. And a number of experts since yesterday have also expressed concern that removing the on-arrival test makes Canada vulnerable to potential new variants in the fall. So I'm wondering if you could provide some justification for those changes. Thanks.
Hi, it's Dominic LeBlanc. I'll offer a few comments, but I think Dr. New is also well placed to offer some of the scientific and public health rationale for those measures. The government has said from the beginning of the pandemic that we would evolve measures at the border, including adding, as you'll remember, last fall or during the winter, increased levels of protection for Canadians. And we also said when it's safe to do so, we would look at measures that could be relaxed while at the same time and all the while maintaining the necessary protection for Canadians. That's why the government started initially with opening the border to fully vaccinated visitors from the United States, and later in September, as you know, opening the border to visitors from other countries, but also fully vaccinated people. I think Dr. Tam and Dr. New have said in a number of press conferences over many weeks that the importance of having an arrival test, whether it's a random arrival test for those who are fully vaccinated or an obligatory test for those that aren't, is one of the essential elements in tracking data on whether vaccinated people can in fact carry the virus, or obviously looking at having reliable and accurate data with respect to potential variants of concern. But in terms of the scientific reason why a pre-arrival test was preferred as opposed to an on-arrival test, perhaps Dr. New, you could add something.
Okay, well, thank you very much, Minister LeBlanc. What I would say, first of all, with respect to vaccination, because we're talking about fully vaccinated travelers, I think I said before is that it's a question of what I would call a reasonable risk management. So, as we know in Canada, a major part of the reason why we're opening up our borders in a very sort of slow and stepwise fashion is because the Canadian population is now quite highly vaccinated, and certainly I think we could still do better. But we have a more resilient population in terms of protection at a population level against COVID-19. So 80% with one dose, tracking towards 60% for two doses. I think we could do better, and we should go for 90% plus. I think for double vaccination coverage, so that we have a more resilient population. Now to the question of who we should let into the country. As we know, certainly fully vaccinated travelers, if they have adequate proof, certainly would pose, I would say, a much reduced risk in terms of both importation and then even further transmission of the virus once they enter Canada. The reason for the pre-departure test is that we know that no vaccine's perfect, and also that the test, I think, gives us at least that level of assurance that should someone show up before they even get to Canada with a positive test, and obviously they shouldn't be allowed to, let's say in this case, board a plane and then come to Canada. Coming to Canada, certainly what we've done is we've followed the data, and the data we've seen in both sort of land and air travel arrivals has shown that in terms of the arrival test results, an extremely low percentage, and it's been dropping over time, have actually come up with a positive test result. The last figures I've seen are sort of like fractions below 1% for both the air and land travel. So as sort of a risk mitigation, I think that it's reasonable this time, as we continue to follow the science, that we still keep the pre-departure test in place. So that's the level of assurance in terms of travelers not coming to Canada already carrying COVID-19. But once they come here and they have that sort of a negative pre-departure test before coming to Canada, then in terms of their actual risk of still somehow having COVID-19 and then passing it on, I think is much reduced. The testing results bear that out to date with the experience we've had so far. And as well, we know certainly from the evidence around the world, fully vaccinated individuals, although there's always that chance, it's much lower in terms of actually having COVID-19 and then also possibly transmitting it to others. So that's the rationale behind that. But we'll continue to follow the data, and if we need to make adjustments in the future based on what the epidemiology and the data shows, we'll do that.
Great, thanks. And my follow-up is again on the border, and it again points to recommendations from that expert panel's report, and it has to do with partially vaccinated and unvaccinated travelers. They had recommended shorter quarantine periods for those individuals in line with the testing protocol. I think for partially vaccinated, it was if they test negative with their on-arrival test, they can be let out of quarantine, and unvaccinated could be let out of quarantine if their day 7 test is negative. So I'm also just wondering why the government is still insisting on a 14-day quarantine period for those individuals.
There again, I think obviously respect the considered opinions or recommendations, like you say, from the testing panel. There's a lot of science and evidence that continues to grow every day, and I think at any given point in time, experts can look at data and make their best recommendations based on the data that's available at that point in time. What I would say is that again, it's a question of what we might call reasonable risk management. Everyone, I think, is of the same mind in terms of the incubation period. The outer limit, certainly from what we've seen around the world and here in Canada, is 14 days, meaning that if someone's actually exposed to the virus, it can take up to 14 days for that person to develop symptoms and then obviously be infectious to others. But obviously it's not equally distributed, and the vast majority of individuals certainly develop symptoms in terms of their incubation period well before the 14 days, 3, 4, 5, up to 7, 8 days. And that's where the bulk of individuals who actually have COVID-19 would be expected to develop symptoms. So I guess to the testing panel's point, the incremental benefit in terms of someone being let out, let's say at a shorter period of time, not the full 14 days, yes, you would still capture most of the people that would actually have COVID-19 based on sort of what we know about incubation period, in terms of the vast majority of people developing symptoms. But you would miss a certain percentage. And so the incremental increase in terms of the safety and security by having it up to the full 14 days, let's say for a quarantine, that obviously is something that's considered by the decision makers. And so I think in terms of being very, I would say, conservative, prudent in terms of protecting the health and security of Canadians, that's how the government sort of continues or lands on the 14 days at this point. Like I say, the science continues to evolve, and there's certainly I think nothing's ever carved in stone, and down the road there could be modifications as appropriate, guided by the science.
Thank you, Dr. New. And operator, over to you for the next question. Donc, pour la prochaine question.
Thank you. Merci. Our next question, la prochaine question. Louis Blouin, Radio-Canada. Your line is open. À vous la parole.
Bonjour, une question pour le Dr. New. Ce matin, le premier ministre du Canada a participé à un événement public en Ontario. À sa sortie à l'extérieur, il y a des dizaines de personnes qui l'ont entouré. C'était vraiment un bain de foule. Le premier ministre portait un masque, mais il y a plusieurs personnes qui ne portaient pas de masque autour de lui. La distanciation physique n'était pas respectée. Cette semaine, on a vu d'autres chefs de chefs conservateurs, le chef néo-démocrate sans masque, serrer des mains sur le terrain à l'extérieur, prendre des photos, pas de distanciation. C'est des scènes qui risquent de se répéter beaucoup si une campagne est déclenchée. Alors, ma question est la voici, les chefs devraient-ils être plus prudents si on considère la menace du variant Delta? J'aimerais avoir votre avis là-dessus.
Merci pour la question. Ce que je peux dire, c'est pour tous les Canadiens et Canadiennes, n'importe qui, c'est toujours important de reconnaître le fait que oui, on n'est pas sorti du bois, on peut dire, des bois maintenant actuellement. On fait un bon travail, je pense, comme dans l'ensemble du pays avec les programmes de vaccination, comme on a déjà constaté, 80% des Canadiens déjà vaccinés. C'est un des plus hauts taux de vaccination partout dans le monde, et aussi pour la deuxième dose. Mais ce qu'on voit aussi dans les autres pays, c'est que c'est pas seulement les programmes de vaccination qui peuvent garantir le succès contre la COVID-19. Et on voit aussi des recrudescences de COVID-19, aussi peut-être aussi à cause de le variant préoccupant Delta, que c'est très important encore de continuer avec les mesures de santé publique à l'échelle de la population, mais aussi des précautions individuelles et assouplir comme les mesures au fur et à mesure, toujours en regardant qu'est-ce qui se passe avec l'épidémiologie. Ici, il faut modifier les mesures de santé publique s'il y a encore peut-être une recrudescence. C'est quelque chose il faut suivre. Concernant le comportement de n'importe qui, je pense que je peux dire que c'est humain, je pense que c'est difficile. On est toujours tanné, on est toujours comme tout le monde est épuisé avec tout ce qui se passait pendant, comme je pense, 18 mois maintenant. Et c'est quelque chose, il faut encore souligner le point. Je pense que oui, on pourra attendre que peut-être de temps en temps n'importe qui peut-être oublie ou peut-être pour un moment peut-être faire ce qui est nécessaire, important, peut-être à la distanciation physique, mais je pense en général, tout le monde comprend que c'est enfin important, même si on a peut-être double vaccination. Moi aussi, je continue à porter le masque quand je sors de la maison, même avec une double vaccination, seulement parce que pour moi, c'est une autre couche de protection personnelle. Donc, je pense que c'est quelque chose qu'on peut souligner avec nos efforts d'éducation aussi, d'information pour tout le monde, mais je pense que pour l'instant, on est sur le bon voie. Il faut être aussi optimiste. Et si l'été, tout le monde va aller dehors, c'est comme vous avez dit qu'avec l'été, il y a beaucoup de choses à faire dehors avec les activités. Je pense qu'il faut faire ça avec un peu de prudence, aussi être conscient avec les précautions pour prendre à l'échelle individuelle.
Et je comprends que chaque juridiction a sa propre réglementation, mais les chefs, eux, passent d'une province à l'autre. Quelles seraient les directives que vous recommanderiez pour ce genre d'événements partisans sur le terrain? Les précautions de base, peut-être que les partis devraient respecter pour éviter la contagion. Par exemple, je ne sais pas, s'assurer que tout le monde a reçu ses 2 doses. Le port du masque, la distanciation, quels seraient peut-être les éléments de base que vous recommanderiez? Et pour M. Leblanc, les partis politiques n'ont-ils pas le devoir de donner l'exemple?
Première chose, je pense que tout le monde peut donner un bon exemple à tout le monde d'autres aussi, comme les autres membres de la famille. Je pense que c'est important pour les leaders, mais je pense que c'est important pour tout le monde de donner un bon exemple aux autres. Ça, c'est un point. Concernant les voyages, pour n'importe qui, si on voyage d'une province à l'autre, c'est toujours important d'être peut-être conscient. Il faut toujours regarder c'est quoi les consignes ou les conseils des autorités de la santé publique à l'échelle locale, à la destination finale. Mais si on travaille partout dans le pays, c'est toujours important d'être toujours, comme dire, reconnaissant de qu'est-ce qu'on exige dans les différents endroits. Donc, ça, c'est un autre point. Et je pense que les principes, tout le monde connaît très bien c'est quoi les principes. Je pense en anglais, on parle toujours des 3 C's, avoid crowded places, close spaces, close contact. En français, je dis, faut éviter les becs, les endroits bondés, le contact étroit et les espaces clos. Donc, je pense que les principes, c'est toujours là pour tout le monde. Et avec les précautions individuelles, on parle toujours de la distanciation physique, le port du masque, et des bonnes hygiènes aussi pour se laver les mains fréquemment. Donc, je pense que ça continue et je pense que tout le monde est bien, comme il dit, sensibilisé. Qu'est-ce qu'il faut faire?
Si vous me permettez, moi je pense, M. Blouin, le Dr. New a très, très bien répondu à la question. Nous avons, comme formation politique, toujours essayé de donner le meilleur exemple. Nous disons à nos collègues toujours de suivre les directives de la santé publique locale ou provinciale, surtout si on voyage maintenant d'une province
province or in a region, especially if you're traveling from one province to the other.
Et les principes de base que le Dr. New vient de répéter, d'ailleurs que le Dr. New et le Dr. Tam ont répété depuis le début de la pandémie, tiennent encore. On s'attend que les gens soient conscients de ces obligations-là, même ceux qui sont doublement vaccinés. Il n'y a rien de plus important que de suivre les consignes des autorités sanitaires locales, mais aussi on peut aller au-delà, on peut prendre des mesures supplémentaires pour se protéger et protéger les gens autour de nous, et c'est ça qu'on va essayer de continuer de faire.
Merci, Monsieur le ministre. Donc, opératrice, à vous pour la dernière question. Donc, operator, over to you for the last question.
Merci. Thank you. Our last question, la dernière question, Mackenzie Gray, CTV News. Your line is open. À vous la parole.
Hi there. My question is for Mr. LeBlanc. The U.S. has not approved AstraZeneca, and Dr. Fauci has been very clear in the U.S. that people should not mix and match Pfizer and Moderna. Why do you think the Americans would let in people who've received AstraZeneca or mixed and match when they have been very clear that they are not approved either vaccines or strategies in the U.S.?
So, Mackenzie, I'll offer a few comments, and perhaps Dr. New may also want to add something. We recognize that every country has its sovereign responsibility to make the best decisions it can make in the interest of protecting their populations. And we've seen around the world different health authorities recommend or approve different regimes of vaccination that they, in their judgment and in their responsibility, think are appropriate for their citizens or for their populations. In Canada, Health Canada has worked obviously collaboratively with provincial and territorial public health authorities and a body of expert scientists and doctors who have continually provided the best advice possible to the Government of Canada and to Health Canada in its responsibility as a regulator. And we've made the best decisions we can based on the scientific advice that we have that we think are in the best interests of Canadians. Other countries have done the same thing, but there has also been, from the beginning of the pandemic, a very considerable effort amongst countries, certainly European countries, Canada, the United States, other allies, to share scientific information and for Health Canada authorities to talk to their counterparts in the European Medicines Agency and the Food and Drug Administration of the United States. I know Dr. New and Dr. Tam have ongoing conversations with their counterparts in other countries around the world, very much with the idea of developing as much as is possible the right policies that will, at the same time, allow Canadians, or in the case of Americans, the ability to travel and safely visit other countries. But at the same time, we don't purport to tell American health authorities the best way and the best judgment they have in terms of what's the appropriate vaccine regime. But that being said, there are ongoing conversations, and we expect over the coming weeks that advice to evolve with respect to authorities in Europe and potentially in the United States as well. So we'll continue to work with them in a collaborative and transparent way. But at the end of the day, we respect their ability and their right to make decisions in their own jurisdictions, the same way they would respect Canadians' decisions. But Dr. New may have some more updated information on ongoing conversations that have taken place very much since the beginning of the pandemic. So there's nothing new in terms of collaborating with American or European allies in particular. But Dr. New, over to you.
Well, thank you very much. I think you give a very excellent, comprehensive answer, Mr. LeBlanc. There's not really much more to add. What I would just say is that, the evidence continues to grow, right, in terms of the different types of regimes or the vaccines used in different countries. And I think, as they say, the proof's in the pudding, certainly with what we've done in Canada, which was based on some studies, the evidence in terms of the mix and matching. You can see right now what's happening in Canada, with our vaccination approach strategy, the fact that that our case numbers are dropping, hospitalization, deaths, and so on. So that's adding to the body of science. And I think, as the Minister LeBlanc said, it's a matter of also continue to exchange information between the sort of the scientific authorities of the different countries. And once I think there's sort of a good understanding and everyone being comfortable with what the science and the evidence is showing, that hopefully we can get to a place where we do make it easier for citizens of individual countries to be able to travel to other countries with sort of a more of a common approach. But you're right, there's lots of ongoing discussions, and the work continues.
Minister LeBlanc, you said in your response that you're expecting that advice from Europe will evolve in the coming weeks. Right now, in particular, Canadians who got Covishield, the Indian version of AstraZeneca, there's a number of major countries, including the UK, that won't recognize that vaccine. So are you saying that it's your expectation that things will change around Covishield and mixing and matching in the coming weeks with Europe?
Well, I wouldn't want you to extrapolate in terms of a precise circumstance around one particular vaccine. What I think I said, and what I certainly meant to say, is that the ongoing conversations between Health Canada, regulatory authorities, and people like Dr. New and Dr. Tam with their counterparts will, we believe, over time lead to an evolution and an adjustment of some of these measures. They're obviously bilateral but multilateral conversations taking place between Canada and other countries and organizations like the World Health Organization. So we don't expect this to be a static circumstance. And I think over the next number of weeks and months, there may be revisions provided by health authorities around the world with respect to these vaccine regimes, but we don't have precise information on a particular vaccine in a particular country and when those authorities may choose to adjust their particular advice or their particular decisions. But we know that there are ongoing conversations, as I said, both bilaterally between Canada and various countries, but in multilateral fora as well. So we think and believe over the coming weeks and months, some of these situations will likely evolve, and we'll continue to be engaged in those conversations. But like other countries, we'll continue to make decisions and offer advice that we believe is in the best interest of the health and protection of Canadians. And we obviously respect that other countries will want to do the same thing. But if Dr. New has anything additional to add, he obviously can.
No, there's nothing really more to add. Like Minister LeBlanc answered, the conversation discussions continue as we speak, and like I say, a lot of it has to do with the science and the data that continues to accumulate throughout the world. So I'll leave it at that. Thank you.
Thank you, Dr. New, and thank you, Minister LeBlanc. Donc voilà qui met fin à cette conférence de presse. That will mark the end of the press conference. Thank you for being with us today. Merci d'avoir été avec nous aujourd'hui. And operator, over to you.
Thank you. Merci. The conference has now ended.